This video will list 3 parts that you need in order to create a searchable question. In other words, how do you take a case study or a patient information sheet and be able to actually search a database and find articles related to that topic? Those 3 things are patient characteristics, patient management, and outcomes of interest. And I'm going to show you how to look at a patient information summary and identify the patient characteristics. And then finally, I'm going to show you how to list the keywords by order of priority. So the 3 things you need in order to search a database, in order to look at a case study or a patient information sheet and to be able to search a database, or you need to look for the patient characteristics. So when you're reading it, look for things like sex, age group, and what is wrong with the patient. What condition do they have? Next, you want to figure out patient management. So what intervention are you looking for, or what diagnostic test do you want to do? That information is probably not going to be given to you. That's going to either come from your clinical expertise, and since you're really early in your career, you haven't really learned that very much yet. So you're probably going to get that either from your professor, may just tell you what treatment plans are usually used to treat that, or you can kind of search on your own using Google or some of your textbooks to kind of figure out what kind of treatment plans are usually used to treat certain things. And finally, you want to look for the outcome of interest. In other words, what result is the patient looking for? So we're going to go to your textbook, chapter 2 of your textbook, and I'm going to show you how to actually identify all those different pieces. So I read the information, and for patient characteristic, it says the patient is 52 years old, so that means he's an adult. It says he has knee pain, so that's his ailment. He has knee pain. And it also refers to him as a he, so we're dealing with a male. So I have my patient characteristics. So my goal is to read this and to translate this information they're giving me into words I can put into PubMed and retrieve articles. So next, I want to know, what outcome is this patient looking for? What results is this patient looking for? Well, if he has knee pain, he probably wants to reduce the knee pain. So that's one outcome that I'm looking for. And I also want to find articles that it says that his pain affects his work and home activities. So he also wants some kind of treatment that will help improve his function. When I'm trying to figure out what interventions to use, you have 3 options. So you could ask your professor what interventions are available for the particular condition you're looking at, or you can choose to go to Access Physiotherapy, and you can choose to pipe in whatever condition you're looking for. So knee pain, and you can click enter. And just kind of scroll through some of the results that you're getting until you find something that will give you some options. And you can also, I'm going to click here, go home. You can type in Access Physiotherapy as well. And these are all textbooks that are specific to physical therapy. You type in knee pain. And then you can scroll through the results. And I scrolled through the results and I found something, let's see. I found this rehabilitation of lower extremity injury. So I had to search for a while. And again, right now, I'm not looking for articles. I'm just trying to find some information, some options on what type of treatments are usually used to treat knee pain, just so I can get some ideas to try to find some articles. So I looked here and I got some ideas on some things. Using the methods I just mentioned, here's what I came up with. So I have my patient characteristics. I have some treatment options that I can use to treat this particular patient. And so my goal is I want to find articles. Are there any articles on recent studies that have been done to discuss whether this is an effective treatment option? And here are my outcomes that I'm looking for to treat these specific things. So now I have some ideas what I'm looking for. Now I need to actually put those keywords into PubMed. And so I'm going to do what's called keyword searching, which means I just kind of put the words in the database using natural or common language. And here are some examples of the type of words you would use. So of these things, what I want you to focus on is that there are advantages and disadvantages of searching this way. Some advantages are that you get to just put it in the database the way you speak. So that can be helpful. And also that you can search across multiple fields. So just know that if I put in knee pain in the database, it's looking for knee pain in the title and the abstract and the title of the journal, all of those places at the same time. And that could be good or bad. And it could be good in that I'm searching, I'm getting multiple hits, but it could be bad in that I'm getting multiple hits. So I could be getting some irrelevant results. Another thing is that it's useful for something called truncation. So say, for example, jumping, I can put in JUMP asterisk on the end, and then I'll get multiple endings, like jumping, jump, jumps, things like that. But sometimes multiple search terms are needed in order to find relevant results. So there are some good things and some bad things about searching that way. Here's my searchable question that I came up with. In an adult male with knee pain, is manual therapy and dry needling effective for reducing pain and recovery of function? So I want to find articles that address this. When I put the words in PubMed, I have to look at this question and actually pick out the keywords that I'm going to actually put in the search box in PubMed. So adult male, knee pain, manual therapy, dry needling, pain, and recovery of function. After I've identified my keywords, I need to list them in order of what's most important and what's least important. And the reason I do that is because I have 5 concepts that are here. For example, knee pain is a concept, manual therapy is a concept, dry needling is a concept, but I'm putting those together. Pain and recovery of function, that's a concept, adult is a concept, and male is a concept. When I put all 5 of those in a database, I may not get anything because it's just really specific. And if that's the case, then one thing that can help me is eliminating one of the concepts. So if I start on the bottom and work my way up, so if I put all 5 in and I'm not getting anything, then I can eliminate male, and then I can only focus on 4 concepts. And if I'm still not getting anything, then I can only focus on 3 concepts. So that's why you put it in this order.